My constituent continues, quote, "This morning I was placed on the DEI watch list website and publicly identified as a target. Compounding this distressing reality, my personal and internal CDC-related information has been exposed on a public website, placing me in immediate danger. I have since received unexpected deliveries to my home, and my personal information is now in the hands of individuals aligned with the views of the current administration, individuals whose intentions I cannot discern, but whose actions are already proving to be invasive and threatening." The letter goes on, quote, "I'm left with no choice but to remain vigilant, prayerful, and confined to my own home, effectively a prisoner for doing my duty as a public health professional. The fear and uncertainty that have overtaken my daily life are not just a personal burden, but a dire warning about the dangers faced by those who commit themselves to the work of health equity and public service. Even more distressing is the silence and inaction of those who should be stepping in to address this injustice." That's a letter I received today from a constituent who has served at the CDC for decades and who has now been doxxed and publicly targeted and fears for her safety. Apparently because working to reduce health disparities for communities and people who have lousy access to health care and poor health outcomes makes you a political target. And this constituent isn't alone. There are dozens more CDC workers in Georgia who have faithfully served our country for years and who face the very same harassment and the same threats. Mr. President, this is ugly and menacing stuff, and the license for it comes directly from the President of the United States. As we speak, the world's flagship disease control agency is in chaos and under political attack, and public servants who dare to try to improve health outcomes for the poor and disadvantaged fear for their safety. All brought to you by the President who said maybe bleach injections could cure COVID. None of this bodes well for the health and safety of the American people.